So OCT angiography has caused a lot of buzz in the retina world, and it's the latest technique that we have. There are a lot of studies which have of late come up describing the role of OCT angio in strabismus and amblyopia. And I would just try to give a brief overview of that and whether a strabismologist needs to know OCT angio or not. OCT angiography, why are we talking about it? Because it's a non-invasive imaging technique. It gives a high resolution volumetric blood flow information of the retina, and at the same time we do not have to inject a dye. It is a non-invasive fast acquisition time machine, and it might be particularly helpful in children who will be obviously uncooperative for a fluorescein angiography. So this is how an OCTA scan looks like, where you can image the superficial and deep vascular plexus as well as the vascular plexus on the optic disc, and corroborate with the clinical findings on the fundus photo or on the OCT. A lot of studies came up which talked about the OCT angiography in strabismus and in amblyopia in particular. So giving a brief overview, there was a lot of information available suddenly, and all of the studies had contradictory results. But few conclusions that all these studies gave us was that in patients who have amblyopia, there is a decrease in macular vascular density of the superficial capillaries as well as the deep capillaries. You see this area, which is the foveal avascular zone, because the fovea is avascular. And the studies did notice an enlargement of this avascular zone, not only in the amblyopic eye, but in the contralateral fellow eye as well. The optic disc vascularity was also found decreased in the amblyopic eye compared to the contralateral eye. A meta-analysis of all the studies that have been done also reproduced that amblyopic eyes have lower vessel density as compared to the fellow eyes, and not in the deep capillary plexus. And regarding the foveal avascular zone, the studies had contradictory results. We did publish one of ours where we tried to look at OCT angio in amblyopia in 6 to 12-year age group. We recruited all kinds of amblyopia and also adjusted them for their axial length growths. We saw that the superficial and deep vasculature of the amblyopic eye is altered as compared to a normal child who does not have amblyopia, but the vasculature of the fellow eye of an amblyope was also altered. And interestingly, we also saw that the choriocapillaries of the normal eye and the amblyopic eye were different. You see, the normal eye has a pattern which is regular, and in the amblyopic eye, we saw these attenuated choriocapillaries in comparison to the fellow eye, and also the vessel density was reduced. So we concluded that the pathogenesis of amblyopia may involve the choriocapillaries with our study. Maybe they are the source of nutrition for the retina, and perhaps this is where we need to study more the pathogenesis of amblyopia. Few studies talked about pre-treatment and post-treatment differences also on OCTA, because we have documented a decrease in vascularity. One study said that it did not change, and one said that after patching, the vessel density seemed to increase. So this reversal also kind of was corroborating with the finding that maybe it is the pathogenesis of amblyopia involving the retina and the choroid. Again, we have just 2 studies and we still need larger number of patients to prove this point. So just overview of all these studies tells us that there is a reduced vascularization of the affected as well as the fellow eye. Both eyes are affected in amblyopia. So for studies, we should not take actually the fellow eye of amblyopia to be normal. We cannot presume it to be normal. This vascularization defect, is it the cause of amblyopia, or is it because amblyopia has led to this vascularization defect? We cannot establish that. There is one study which talks about reduced apoptosis in amblyopia, giving it a thicker fovea in the amblyopic eye. Again, not validated. OCTA parameters are helpful because they will help us in maybe establishing the vessel density in amblyopia, but we cannot use them as a surrogate for the neuronal maturity, that is the basis of pathogenesis in amblyopia. And the reversal of changes in OCTA, we need larger studies to actually prove that. There is no correlation in any of the studies between the severity of amblyopia, the type of amblyopia, and the vessel density, of course. Till then, in conclusion, I would just say that these vascular changes which are seen on OCTA, they do not imply a causality of the amblyopia. They are not the cause of amblyopia. It is not clear whether these findings actually lead to amblyopia or amblyopia is causing these findings. At what stage we see them, it's still to be reproduced and validated. Till then, OCTA for strabismus and amblyopia, we can do it, but might not be able to use it that much clinically and for patient treatment. Thank you.